Hi, it's Dr. Ted again. Thank you for turning into another episode of Ask Dr. Ted. As you can see now, I'm home in my home studio, which doubles as a spare bedroom. I worked about 10 to 12 shifts. They're 12 hours each. And so a typical 8 to 12 hour shift. It's quite a bit of hours, but I love it and it's great. And I'm back home again now. One of the most common things I see, especially now in January, is fever in children. And parents come in and they're very nervous about fever. When your kid has a fever, that just scares parents. And it is a warning signal. Do you remember that commercial that they have on TV? They're selling a product and this guy comes out and he says, you know, when your engine has a problem, there's a light that comes on, but your body doesn't have a check body light. Well, absolutely it does. They're called vital signs, right? Your temperature, your respirations, your heart rate, and how fast you're breathing. Your body tells you when something's wrong. And it can. And one of those is fever. And so the way I used to describe to patients when I was in family practice and also in the emergency department now, is it's kind of like your thermostat of your home, right? Your home, you want it to be at a certain range of temperature. You certainly don't want it too hot. You don't want it too cold. And you keep it in that range and it's comfortable. And everybody kind of likes different temperatures within that range. And if somebody goes in and messes with that, you know, we're always kind of getting on each other for turning it up too much or turning it down too much. And your body's kind of the same way. In your body, you have a thermostat. It's in the brain. It's called the hypothalamus. It's part of the brain. It regulates a lot of the things you don't even have to think about, the automatic functions of your brain. Well, one of the functions the hypothalamus serves as your body temperature. If you get too hot, what do? We break a sweat. And when you sweat and you get air across you, it cools you down, right? Sweating makes you get cooler. And when we're cold, we shiver and we want to put a blanket on and we warm ourselves up and we keep ourselves in that range. Well, when you get some kind of an infection in your body, and an infection involves bacteria is the one we worry the most about, but viruses can be very worrisome. Funguses, even parasites like malaria is a parasite. And just like people, we eat and we drink and we go to the bathroom. Well, germs, these little microorganisms that nobody knew even existed until they invented microscopes, and now electron microscopes, we know a lot more. Just like we eat and drink and produce waste products, these germs do the same thing. And those waste products, or those toxins, we'll call them, they get picked up by your bloodstream and they go everywhere. One of the places they can go, of course, is your skin, and you can get a rash. One of the places they go is your brain. Blood goes everywhere. When it goes to the brain, it can signal the hypothalamus, and your typical body temperature normally is 98.6. When those toxins get to the brain, they tell the thermostat, they turn it up, and they say, we don't want to be 98.6. We want to be 101.9 or 103, or whatever that temperature is. And until you get to that higher temperature, what do we feel like? When you're first coming down with an illness, we just kind of bundle up. We want to put a blanket on. We want some hot soup. We shiver. And what does that do? It generates heat and it holds the heat in, and our body temperature goes up. And because our hypothalamus, our thermostat has been set higher. And then we feel pretty good. And we feel like, okay, we're back to where we think we're normal. Then our mom comes in and goes, oh my word, you're burning up. Or you feel so hot, and you can feel. Moms are good. They're actually better than those ear thermometers. When they actually ask mom, do you think your kid has a fever or not? Moms are more accurate than the ear thermometers, but sometimes you still want to see a number. And so your mom comes in and says, oh my, you are so hot, you're burning up, you have a fever. And since not nobody, but some people don't know what that means, it's kind of worrisome. And it's just one of those things. When your temperature goes up, typically your heart rate will go up. Your respiration rate will go up because you're burning more energy. When you burn more energy, you need more oxygen. So your heart rate can go up, your respirations can go up, your temperature is up. And so sometimes, you do look sick, and it's kind of the warning that, something's going on in here. It's generally one of those things that you don't need to worry too much about. There's a couple of things to think of. Number one, in a child, any child that's less than 60 days old and gets a fever, and the way they define a fever is 100.4 degrees for an hour or more. So sometimes you'll see these kids come in bundled up in blankets, and they're going to hold any heat in that there is. And so you say, okay, you can unbundle the child. Don't keep them in 4 or 5 blankets. Unbundle them. let them sit there for 20, 30 minutes and recheck their temperature. And sometimes it's just that. It's a produced fever because we've trapped all the heat in. But if they're 100.4 or higher, younger than 60 days, you just got to go in and be seen. There's just too many things, and I can't explain why. Especially if they're under 30 days. Any fever, even in a baby that looks wonderful, there's still some serious infections they can have with bacteria that you just have to check for. Even the doctor won't know, and they usually do some blood tests and some other things to make sure, because these are all treatable things if you go in. So a child, 60 days or younger, and especially 30 days or younger, you go in. There's no question on that one. Whether they have a fever or a rash or not, whether they look sick or not, even if they look wonderful, you just go in and have somebody that's seen hundreds or thousands of serious infections and knows how to determine if it's anything worrisome. You just go in. If you've got a 2-year-old or a 4-year-old or a 15-year-old, you have a little bit more time. If they look sick, I mean, they just don't look good. Okay, first of all, you say, well, let's give you something to reset the thermostat and bring the temperature down. So you give them something like Tylenol, but even better than Tylenol is ibuprofen. The name brand of ibuprofen is Advil or Motrin. I don't make any money from anybody. I'm just doing this as a parent to a parent who's a doctor, and I've seen thousands of these kinds of things. I'm hoping I'm saving people some stress and some money and not having to go in if you don't need to. So you give them Tylenol or Advil or Motrin, and you just give them some time, give them some fluids, give them anything they like, water or juice or milk or soup, whatever they like, because when you run a fever, you lose a lot more water. You lose it through your breath. You evaporate more from your skin when you're hotter. I mean, if you think about it, you put a pan of water on the oven. If you turn up the heat, the water will evaporate faster. Well, people are the same way. So you got to give them lots of fluids, give them something for the fever, and then watch them for half an hour to an hour and see how they look. You can wait an hour. And if in an hour, after some ibuprofen and some Tylenol, and you can give those together, by the way. I don't know where this myth that you can't give those together. I take them together. I've given them to patients together for 28 years, and they do just fine. It's like saying you can't eat mashed potatoes and gravy. Yes, you can. In fact, they work really well together. And so I don't mean to make light of it, but there's a lot of myths, and you can give Tylenol and Advil. That's fine. If you have kidney damage, then don't give the ibuprofen, right? And talk to your doctor again. Every case is different. So you give them the Tylenol or the Advil and some fluids, and you watch. And if they start feeling better and their fever goes down and they feel great, they don't have any pain, they don't have anything strange going on, they actually feel much better, aren't you glad you didn't go in? Because the doctor's office is going to say, well, they look good, and they'll look at their ears and look at their throat and some different things, and then they'll probably just send you home. If you, however, you give them the Tylenol or the Advil and you take the blankets off and let them cool down, give them some fluids, and they say, Mom, my ear is really hurting, or my throat is really hurting, there's nothing that's going to hurt if you wait a day or two. If your ear's hurting, I usually have my kids, we'd take them and look in their ears. You just can't tell. There's no way without looking if you have that or not. But an ear infection, people are worried. Is it going to be a problem if I have an ear infection or a strep throat? Of course, you want to be treated for that, but you can wait a day or two. There's no danger in waiting like that. Parents come in so worried, and most of the time we send them home with just Tylenol and Advil and just say, take these, give them lots of fluids. If anything changes, if their ear starts hurting or their throat's really hurting and it's been 2 or 3 days, maybe we'll take a look. Sometimes people just say, I just have a certain feeling when I get strep throat. Okay, then that's how your body tells you, then you can go in. But just having a fever and you take some Tylenol or some ibuprofen and it gets better and you feel better, you do not need to go in just for a fever. A fever is the body's way of saying, well, something's invaded our space here. And just like colds, the first day or two of when you first get sick is called the prodrome. Everybody always feels worse that first 1 or 2 days. And they get a fever and they feel sick. But you treat it with those over-the-counter ibuprofen and Tylenol. Give it time, give them fluids, cool them down. And if they feel great, you just bought yourself some time. Give them some more time. Give them another day. Do it another day. How many days do you need to worry after a fever? Most illnesses, most cold viruses and influenza and these different kinds of things, generally 1 to 3 or 4 days is pretty typical. Once you get to the 5-day range, then it opens up a whole nother possibilities. Anybody that's had a fever 5 days, I say bring them in. Let me see them. If they have really bad ear pain, if they start getting weird, different symptoms, they're coughing up all kinds of really weird colored stuff. Again, these are the kind of things you may want to just, it's hard to call your doctor's office because the liability issues, nobody's going to give advice over the phone unless you really know your doctor real well or your provider. And nurses are told at the hospital, we don't give advice because it's all kinds of liability issues, as you can imagine. So fever is one of those things it's kind of an iffy thing. It depends on how the kid looks after an hour, after fluids, and after some Tylenol or ibuprofen. If they're looking better and feeling better, you just buy yourself some time. You don't need to go in. Next day, same thing. You can give ibuprofen and Tylenol in the morning. Again in the afternoon, you can repeat it, maybe before they go to bed. And if every time you give it, they feel better, they look better, you bought yourself some time. You do not need to go in. If, however, severe ear pain, of course, if you see something draining out of the ear, which is not a bad thing, a ruptured eardrum, it sounds like an explosion. No, it's usually a pin-sized hole, and it helps the fluid drain out and drain down the eustachian tubes, and it helps drain the ear infection. It's actually how the body sort of heals itself of an ear infection. You don't have to have antibiotics for an ear infection. We use them because it makes people feel better, makes our kids feel better, so we certainly use them. But you bought yourself some time. If there's no drainage, no severe ear pain, you don't have a horrible headache, your neck isn't stiff, no unusual rashes, and you're feeling better on medication over the counter, then you bought yourself some time. If you have, we usually say fever plus a terrible headache, fever plus severe ear pain, fever plus, cream of mushroom tonsils, right? Cream of mushroom discharge coming out of your tonsils. Yeah, you want to go in and be seen for that. And nobody's going to fault you for going in. I want to stress that. Sometimes people come in just because they're anxious and nervous and they just don't know. First-time parents, that's fine. We love seeing those. We love seeing those kind of patients. But sometimes if you don't have money or time, it's sure nice to just give them some stuff over the counter and they feel better and look better and saves you all the wait in the waiting room and everything else. Plus, you're going to be exposed to everything and everyone else in the waiting room. You don't want to go home with something you didn't take in. But fever is one of those things, it depends, right? Give them time, give them ibuprofen and Tylenol, or you can give it one or the other or both, and give them some liquids and watch them and see how they do. If they have severe pain somewhere, fever plus something, yeah, not a bad idea to be seen. And again, don't expect to call the nurse or ask the doctor over the phone because they just don't know. I've seen people call me and it sounded like nothing, and when they come in, it was something really serious. Or just the opposite. They make it sound like they're just terrible. And then by the time they get in, I look at them and I'm like, oh, it's a cold. We just give them fluids and over-the-counter medicines. And hopefully that'll help you. This is winter. This is the time of year everybody gets sick. I'm just getting over a cold I had maybe a month ago. I was hoarse and coughing and stuff. I didn't take antibiotics. These things get better most of the time on their own. And if you're not sure, just come in. We love seeing you. We love telling people good news. Oh, this isn't anything scary. And every time you go in, you learn a little bit more. And some things you just can't guess, right? Sometimes they'll think it's something and it's not, or you'll think it is and it isn't and it is. But these are things that if you're not sure, just go on in and be seen. One other thing I was just thinking, we were talking about seizures and fainting, sometimes when somebody faints, they can throw up from a faint. Or certainly if you have a seizure, they can throw up. About the only thing you can do if somebody is throwing up and they fainted or throwing up into the seizure is turn their head to the side so that they throw up and out. If somebody throws up and they're laying on their back, they can throw it up and it goes right back in their mouth and nose and they'll get it in their lungs. They aspirate it and that's horrible. That is not good. And so that was one thing I was going to say. I need to remind everybody about that. Okay, hopefully everybody's having a good winter. One more day and we're into February. We're on our way through the winter and these colds and sore throats and things will go away. I'm going to post one tomorrow called, or maybe tomorrow the next day, called 10 ways you can accidentally harm or even kill your baby or your child. These are things every parent should know. Some of them seem like common sense, but some of them you may or may not know. I think it'll be interesting and hopefully it'll help you. Okay, everybody have a good one, and thanks for tuning in. See you next time. Bye-bye.